So we're going to start with sideline where we left off before lunch. So I'm just going to do a couple of things. One of the things we're going to do, we're going to start at the head and work our way down. But I like to take the time right now to just start opening up the hip and create a little openness from the upper and lower portion of the body. So this is a very nice stretch here where you bend the bottom leg and stabilize it in two parts. And then you take the leg, top leg, and bring it between your legs and this knee back. Did I do this to you before?
You did.
That's all put together. So you look at that motion there right into the hip. It's awesome. And then when you're done, you want to put this back here and straight so that they're stable, right? And you have a pretty nice alignment. If you look from ear, shoulder, hip, and leg and ankles, you should have some pretty nice alignment. And you see Laura, she's not rolled over, but she's on her side, so that's wonderful. Okay, so we'll start. Yeah, that's right. We did all this, Laura and I. We travel around to do this kind of thing. So here, so we're going to start by just making some nice contact with the palm of our hand onto the top of the shoulder, and just create a nice stretch right in the beginning. Just from arm straight and allowing the body weight to come through my extended arm. And after some general here, you want to try a couple of things to see what works as far as maybe with a broader surface and more in a sustained pressure. So here I'm using my forearm. That pressure is okay?
Yeah, pressure is perfect.
And then to be more specific, you could use thumb over thumb and come right into the top of the upper trapezius. And about halfway between the side of the neck and the acromion, there's this little knot here usually on everyone. And you can press down towards their feet. That helps release tension in the neck and head, shoulder. And then we're going to move around. So we're just going to come to the side here, and we use the palm of our hand to compress through the temporal area of the head. So palm of the hand, and we're just going to compress. So basically, when I say compress, it's more like perpendicular pressure, like you're just leaning in. You're not pushing. There's no need to push. Your arm is extended, and the weight is just transferring through. And we're going to come around video so you can see, and also everybody, come. This is the aerobic section of the class. So you notice here how I'm sitting. I'm sitting in seizo. If this is comfortable for you, I'm sitting on my heels. And my knees are about even with the top of her shoulders, and I'm right up against her because you really want to have some nice contact, right? Then I'm going to take her top arm and place it over my arm so that we have nice contact. But also, now I can move the shoulder very easily. And we're going to start by taking my thumb and placing it right up underneath the occipital ridge here. And then I'm going to depress the shoulder a little bit so she gets some nice digital compression in the suboccipital muscles, the muscles that are responsible for the rocking and tilting of the head, so it helps free up where the neck connects to the skull. Pressure's okay. I'm going to do a little petrissage here into the side of the neck. Just working right to the top of the shoulder. And here's all soft tissue here, so I'm going to take my fingers one over the other and do some nice compression as I'm doing some circular compression. I'm going to intertwine my fingers, place them right on the top here of the shoulder. I'm going to inhale exhale, I'm just going to lean back. Nice stretch of the neck. Also, it allows you to transition into the shoulder girdle, which we're going to do. And that transition of the shoulder girdle is simply this. The fingers come undone and you're supporting the shoulder girdle on both sides. That way you can easily take it into nice range of motion. Okay. Then I'm going to let the shoulder girdle fall forward. And that makes the vertebral border of the scapula a little bit more prominent, so you can take your fingertips and hook them underneath and rest the back of your hand on your leg. And then you're just going to lean to the side. So what I'm doing is hooking up underneath the lip of the scapula and shifting my weight to the side and just lifting it, easing that scapula off the back of the rib cage. Very nice. Okay. Now we're going to work the front of the shoulder, and even in this position, if you let your fingers come and just palpate, you'll feel a ropey kind of situation, and that's the pec muscles. I mean, you can feel this more superficial pec major, but if you let your fingers sink in a little deeper and do this cross fiber motion, you can feel the contour of the pec minor. And again, it's the pec minor that is one of the main culprits of bringing the shoulder forward when it's over-contracted because of its 45-degree angle and its attachment to the coracoid process. So we're going to try a few things to loosen up the pec major and minor, and those few things are this. From this position in Seiza, kneeling, I'm going to come up on still on one knee, but 1 foot. And I'm going to take the arm and extend it over like this. Okay? I'm rotating a little bit so the work's in front of me. And you're going to be specific to this small area, which is the pec major. First, you just want to do some gentle palpation to make sure you know where you're at. And here, obviously, only coming down about this far so you're not engaging any breast tissue, right? So you want to come up in these upper fibers. And my thumbs are coming up underneath here. My top fingers are gripping a hold. So what I'm going to be doing is I'm going to be rolling those pec major fibers out to create some length. And rather than go like this, I'm going to keep my arms extended and simply lean back with my body weight. So I'm rolling those fibers out. So my thumbs are engaging that bottom layer and just rolling it out. Okay. Yes, she said yes. It's okay. So, of these two, pec major, pec minor, the pec major is the larger, but also the more superficial. So after some loosening of the more superficial, larger pec major, we want to go below the pec major where the pec minor is. And to do that, I'm going to take this hand and just lift the arm straight up and take the fingertips of the other hand and slip underneath pec major. And rather than hunting around for wherever pec minor is, I'm going to suggest that your fingertips come right straight down and you'll feel the rib cage. Okay? And then I just want you to follow the contour of the rib cage up, and it'll take you right into the lateral border of pec minor. You're right there. You'll bump right into the lateral border. You can't mistake it. It's right there. And you can do digital compression to help release pec minor. That's very effective. You know, and you want to work the extent of the muscle. And you can also pin the muscle and then stretch the muscle. Feel that intense?
Yeah.
Intense is good for video sales. So that's a really nice way of working pec major and pec minor. Okay. And after that, we want to do a nice stretch here of the area. So I suggest you come back down again. And we're going to lift the arm straight up and then overhead and then back. And that's how you get the muscle, because that's the angle of the muscle attachment on the humerus. Feel?
Mm-hmm.
A variation of that stretch is bending the arm, placing their hand on the back of their neck. You're going to use their arm as a lever as you stabilize the hip. Just bring it back a little bit. Feel that?
Mm-hmm. Yeah.
So if you're working on someone bigger maybe, and it's just to try to muscle the arm or hold it up even sometimes too heavy, this is very nice because it acts as a lever. I like this quite a bit, and also helps open up serratus muscle too, which attaches right at the inferior angle of the scapula, so you can get a little bit more additional openness to the shoulder girdle. Okay, great. So let's just do that much.